Good morning. It is Monday morning, and what better to start your Monday morning with than Farina, our wonderful PA here at Blue Med Center, and January Howard getting the what are you doing on her?
I am doing a vampire facelift.
All right.
We have used January's blood cells, spun them down, and injecting them back into her areas which have lost some volume. She's beautiful, so she doesn't really need too much.
She is.
But yeah. So she's doing
Stop
great.
it some more. I can't smile. The numbing's really good, guys.
Yeah, so we did numb her, and it was just a topical numbing. So I'm kind of injecting wherever I feel I need some collagen and elastin to come back and start producing.
Okay, fantastic. So we figured since it's Halloween month, we would do some vampire procedures and educate our viewers a little bit about the vampire facelift here. But I think you're going to be taking this a little bit further with your you're using platelet-rich plasma. That's what's in the product, or
Yes, it's platelet-rich plasma only with some anticoagulant, and she is going to start seeing some results in about 3 weeks.
fantastic. What kind of results are to be expected?
She's going to start having really pretty texture to her skin in about 3 weeks and the glow, and then in about 3 months she'll start noticing the tightness and the texture and the collagen production as well.
Great. And so as you guys are watching this, Farina here is a physician assistant with a great background. She has a injecting background. She does all the vampire procedures here with platelet-rich plasma from head to toe pretty much. So we can do scalp and hair rejuvenation with this. Definitely all the skin rejuvenation. Also, she's injecting right now, but I know you also do this with a microneedling device and drive it into the skin. It's almost like aerating your lawn. I always tell people. And then we're gonna go and do the vampire breast lift today, and even the O shot. So while you're injecting, I was gonna right. January's like, oh, and that's what we call the trifecta here. And so in terms of some of the other applications that you're going to be doing, I won't be able to, of course, have all this on film today, but we are filming some for our website today, January, so thank you. And what are some of the other areas that she's going to be doing, and what are the benefits?
We are going to do the breast lift, which will help rejuvenate the breast as well. The breast tissue makes it look fuller. It does give it a nice cleavage look as well. And just regenerates the area too. So if you have any kind of hyperpigmentation or any kind of texture problems in that area, that will help with that too. And then of course with the O shot, the O stands for orgasm. A lot of the times if you start noticing that it's...
I think our viewership just went up with that.
It helps a lot with that. As a side effect, it really also helps with the urinary incontinence if anyone is dealing with that. So, and it rejuvenates the vaginal tissue as well.
Perfect. Okay, great. So yeah, the O shot has gotten very popular. Along with, for men, they do the P shot. Dr. Charles Runnels invented those procedures, and we got trained here a few years ago and have been offering that quite a bit. So we also like to have, sometimes a couple comes in and we'll do the love shot for them as well.
His and hers.
Right. So January already has some really nice skin. This will just help to keep her preserved. And
prevention is the key.
Right.
Yes. You're doing fantastic. So the only thing to, I guess, kind of the aftercare or after the procedure, you will notice a little bit puffiness for about 3 hours, and in about 3 days you'll start noticing some of the changes that the PRP will bring along, the positive changes with the skin being really glowy, also with the texture, and then in 3 months is when she'll start noticing the collagen production.
Perfect.
Just in time for New Year's.
Right.
Yes.
And Farina also has a functional medicine background for those that are watching, which means she is skilled in helping people balance their hormones and really helping people feel better from the inside out, because you're doing things from the outside in right now, but if the inside's not in balance, you know, a lot of what's going on the outside is not quite in balance either, right?
Agreed. So yeah, hormone therapy, that's when we really start noticing the changes with our skin and our body and in mental health as well. So definitely doing good. Okay, can we go under right here?
So for these procedures, Farina, as you're doing this, who's a good candidate for something like this, and what ages? I mean, I know January's just in, barely hitting 20 probably right now.
Yeah, exactly. So, I really truly think that if you do this procedure at least once when you're in mid-20 to late 20s, you will preserve and you will prevent. Anybody is a great candidate for it, because as we age, especially in our 30s, we start to lose collagen and elastin a lot faster because of the hormonal shift that we have. So it's really important to start doing this. I mean, if you're in your 50s, this is still a great procedure. We might have to do 2 procedures a year instead of just 1.
Very good.
I don't feel the eyes at all.
Yay, that's really good.
Yeah, I know a lot of people complain about kind of dark circles under the eyes, or just overall, I do a lot of the consults here, and neck and eyes are always the things people want to know about. We definitely have added some things like ThermiTight for the neck, but this is a good procedure to really help with just kind of that tired look under the eyes, wouldn't you say?
Yes, absolutely, and then microneedling as well.
Right.
And that's kind of every month, it's a preventative and kind of a maintenance procedure that we do. Normally I'll combine that with a vampire facial, so we complimentary give the microneedling treatment with the PRP when we do the microneedling facelift.
Very good. So those of you that are watching, if you are interested in this and you call and ask for Ferrina, she's here typically on Mondays and Wednesdays. We're doing a fun event day on Thursday. I think maybe you have just 1 or 2 spots left, where when you come in and have a little filler, which you can also get some PRP with your filler, you will get some free Botox as well. So we're doing a nice special. So feel free to give us a call when you get a chance, if you're interested in learning about some of these, and make an appointment with Ferrina. Well, I'm going to let you two get back to finishing this. I know that the next part will be the vampire breast lift, and then the O shot in January. We'll come back and ask you how that went a little bit later. Thanks a lot, you guys.
Thank you. Thank you for filming us.
You bet.